And one of the great challenges we have in multiple myeloma is its heterogeneity, meaning that we have some patients that seem to have very slow-growing indolent disease, others with very, very active and high-risk disease. And we've made advances across the board in myeloma, but we still struggle with patients that have that highest risk disease. We're actually, over the next few months, redefining high-risk disease so that we better incorporate the right cytogenetic features to it. So I had the privilege of being invited to write a commentary in Blood on studies that have been now done to look at what is the optimal way to treat high-risk disease. And we called it stamp out myeloma because really with high-risk disease, what we've come to appreciate is that we need multi-mechanism of action, and we do need longer therapies that seek to target MRD negativity as deeper response. We know that MRD as an endpoint is important for all patients, but particularly for that high-risk patient to get them into a deep remission and then sustain it. And with the new treatments that we have and multi-mechanisms of action, we are learning that high-risk patients do better when given greater combinations for longer periods of time to keep that disease, as it were, to stamp it out and to keep it down for a long period of time. We still think there's a lot to learn in high-risk disease, and there's a lot of great research going on to help us understand it. But for the clinician today, the take-home message is high-risk disease has to be respected. We can't treat it mildly. We need to treat it with combinations, seeking a deep response and over a longer period of time to sustain that remission.